Hello and welcome to the fourth and final session of the New Jersey Advocates for Aging Well Housing Series. Today we have three tremendous speakers who are going to talk about policy and plans for new solutions for housing for older adults in New Jersey. With us today we have the Mayor of Maplewood, Dean Dafis, Cassandra Warney from CHS, and Laurie Facciarossa Brewer, the New Jersey Long-Term Care Ombudsman. I appreciate all of you joining us today. And after 3 weeks of hearing about the challenges and solutions for housing in New Jersey, they're each going to talk about policies and plans for moving us forward. So we're going to start with Mayor Dafis. Mayor, thank you for joining us. And the spotlight is on you.
I don't know if I want that, Kathy. I don't
Okay.
like to see myself here, but listen, thank you so much for bringing us together and convening this important session to talk about new housing policies and initiatives. One such housing policy and initiative that is fast emerging in New Jersey, which is behind other states in the nation in this particular regard, is ADUs. ADUs, like we needed another acronym, right? ADU stands for Accessory Dwelling Unit. This means an independent living space, either attached to a single family home or detached from the single family home, but on the same lot as the single family home, either as a converted into an independent living quarters from a garage or erected anew on the single family lot. This is fast emerging as a housing option to address several of the housing crises that we're seeing in New Jersey. One of them being affordability, another one being aging in place. It's certainly an opportunity to have our seniors, our aging population. We're becoming more and more of an aging population in New Jersey. It's an opportunity for our seniors to remain in the community that they have built. It's also an opportunity for supportive housing. And it's also an opportunity for housing justice in terms of creating more integrated community. You could do all of those things with one simple ADU. So let's get into it a little bit about this. As I said, this is fast emerging as an initiative, and we're hearing from the State House in Trenton that legislators may be working on a bill to make ADUs a uniform policy available to towns throughout New Jersey so that we are all not doing it alone. So in Maplewood, I championed this a couple of years back after connecting with a fellow town in Princeton and my fellow electeds there who were far ahead of us in implementing ADUs in Princeton, and very successfully, I might add. And since then, I've been working with other elected officials throughout the state so that we could collaborate and make ADUs appropriate for each community. So the way it works, there are options, there are ways of doing this. Typically, the ADU, the single lot, the single family zoning isn't necessarily disturbed because there is one single owner. The owner of the primary residence, and then the ADU becomes a rental. But in some communities, namely Princeton, you can have more than one owner. So you can actually buy an ADU, and that creates more affordable ownership opportunities in New Jersey. The ADU survives the sale of the lot, certainly of the principal dwelling. If the ADU is attached to the single family home, it survives the sale. And local ADU ordinances provide for an annual certification and inspection to ensure that the ADU is still being used from year to year as an ADU. So why would you want to do this, right? There are detractors out there And it isn't easy to do this in our towns, especially if you're in a more conservative community, because the alarm, the perceived alarm rather, is that this is going to destroy single family zoning and destroy the character of our communities. And we know that some of those words are trigger words for certain members of our communities, for certain residents, certainly our BIPOC communities who have been denied economic mobility and home ownership opportunity for generations. The character and single family zoning is how we have redlined in New Jersey and how we have justified redlining since then in a less overt fashion, but it's still the same thing. So this is an opportunity to create more housing using the existing housing stock that we have. We are the most densely populated state in the nation. And it is impossible, certainly when you look at North Jersey, for instance, by way of an example, it's impossible to build housing in our small communities that are already densely populated, where we've built housing developments. So why not use our existing housing stock? It's certainly sustainable, right? And we're talking about an independent living dwelling of at least 700 square feet up to 1,500 or 2,000 square feet. Again, the size of these things varies by community, by local ordinance. And it is truly independent. You have your own entry and exit, your own kitchen, your own bedroom. This is not co-housing. This is not sharing your existing home with someone else. They're renting a room from you, and you share your kitchen and your bathroom. No, this is a truly independent dwelling unit. So the model in this area has been California and other states in the West. They've been doing this since the 70s, and they really have learned a lot. And based on what we know, the better practices in integrating ADUs in our communities, the AARP has put together model ordinances, both for the state, for a statewide uniform solution, but also for your community out there. So you can take what works for you. So let's talk about how you can phase this in. When we started this conversation in Maplewood, it really came to our attention from our older adults, our seniors, as an aging in place opportunity. We are among the Age-Friendly Community Network, and we are rated by AARP. We're very proud to be one of the best places in the nation to grow up and grow old in, right? Truly an age-friendly community. So that's how this came to our radar. And actually, Cathy and I worked very closely together on this. She was a major advocate and researcher in this issue, and we were able to bring out from Berkeley, California, again, where they are experts in this area, we were able to bring out a consultant to walk us through this opportunity. This is truly the missing middle housing. That's really what it is. And it offers opportunities for aging in place, like I said, but also in other areas. So we adopted our first ordinance, and it was really limited to our older adults. It was really limited to seniors. So a senior can either create an ADU for themselves that they would live in and then rent out their home, or vice versa. The senior would live in the original dwelling and the primary dwelling on the single family lot, and they would rent out the ADU to another family. It was very, very narrow. And that is a good way to get started, by the way. That's okay. There's no judgments here. Integrating ADUs into your community is a good idea. And if this is how you get it started and up and running, and you prove the naysayers that it's not going to destroy your community, by all means, please start there and move it forward in that way. So that's how we got started. But as we started going into the community and engaging more more with people about what we were doing, we found out that people said, well, wait a minute. Why are you restricting this only to seniors? Why not make it an accessible, affordable option for all throughout the town? So that's eventually what we did. And to make it truly accessible to all, we made it a permitted use throughout the town. And we're not going to go into the master plan and zoning and, bore people here. But essentially, when something is zoned as a permitted use, you don't have to go to the planning board to get it approved, because going to the planning board, having a full site plan review, hiring an attorney and an architect, all of that is what? It's truly expensive. And then we're doing what? Not making it accessible while we're trying to make it accessible. So this is a permitted use now in our town, and it's open to all. And we've already had a few households look into it. And I think that it's another opportunity to integrate our community in ways that our communities are not already integrated. Maplewood is an example of many other suburban towns in North Jersey, Montclair, Milburn, South Orange, where, you really have, these huge homes on these huge lots. And it just seems like a waste of space and not using those lots, again, in the most sustainable fashion, to create more housing opportunity for folks. But local control, right? You are allowed to put restrictions on these things, how big they could be, how high they can be, the materials that are used. Maybe they should be integrated into the so-called character of your community. So again, that is another way to combat those who fear this sort of initiative. This is something that took traction actually in New Jersey a few years back under our previous governor. And there was a lot of interest in doing it, but again, it was vetoed, I think, and not signed. So I think there's new traction in getting this finally to happen and to provide a uniform solution so that we're not all figuring it out on our own. We have found that people have welcomed this. Even our naysayers are recognizing that it's not something that harms the character of our communities, and it does provide more opportunity. And we're finding that the people who are choosing to do it are initially older adults who want to bring a sibling or a son or daughter with special needs back home from a group home or some other home. In other words, supportive housing opportunity as well. So that is something that you can talk about in your communities. Pitch it that way in order to get people to buy into it and to start it off. The challenges that we're seeing, and we'll segue into challenges in a little bit in this session, is that we need to have more backing from the state. We need to have more incentives, tax incentives and other, to make this more accessible to homeowners, and certainly financial assistance. But we can get into that in a little bit, Cathy. I don't want to hog up all the time here.
Well, thank you. And you did a perfect segue into Cassandra. But I also want to ask you though, before I let you go, that, when this started in Maplewood, it was before COVID, before people were working at home, spending more time at home, before people were building or converting their shed to an office. So do you think that COVID will shape this, create more of a demand? Because we're looking at our living space very differently these days.
Absolutely. And I'm glad you brought that up, Cathy. We have found that since COVID, even our opponents have embraced this idea, because people are living from home. Home now has a different meaning to people. It's where you live, it's where you work, and it's where you play. And social isolation has certainly really made people understand all the surrounding issues with housing a little bit better than they did before. So we found that COVID has actually been a silver lining in pushing this thing forward.
Okay. So we're going to give you a break before we get back to you with questions. And Cassandra, we're going to let you take over with your slides.
Perfect.
Go
Are they on?
ahead. Okay, you're up.
Wonderful. Thank you so much. And really looking forward to seeing how ADUs can be used in New Jersey and what Dean is talking about, which is this missing middle of housing. So my name is Cassandra Warney. I work for the Corporation for Supportive Housing, CSH. We are a national nonprofit who is solely focused on increasing supportive housing in our communities, including in New Jersey. We do a range of things, including policy reform, training, consulting, but I'll also mention that we're a community development financial institution, a CDFI. So we fund affordable housing that includes supportive housing set-asides. And I lead our New Jersey portfolio, where we have partnered with the NJAAW Foundation on a healthy aging and supportive housing initiative. And I'll talk a little bit about some of those pieces, but I'll mention that we are offering an upcoming aging academy that's focused on building the capacity of housing and service providers across New Jersey to be able to offer services that are tailored to meet the needs of their older clients. And I'll share info in the chat in case you or your colleagues want to join that free academy. And I'll mention that we define supportive housing as affordable housing with voluntary services that are tailored to the resident. And so just wanted to take a moment to talk about who supportive housing is for. This slide lays out in New Jersey 16 different systems, most of which are crisis systems, which are the most common in terms of referrals into supportive housing. Obviously, there's significant racial and ethnic disparities in these systems. So it's really important that supportive housing providers are using a racial equity lens in what they're doing, and supportive housing represents an opportunity to be able to reduce these disparities that we see. But in terms of people who are aging, you can see at the far right part of the slide, second to last bar includes a call out for aging. Those are people who are primarily in nursing homes, who could step down to a resource like supportive housing if it's available. But then there's other systems that are on this slide where there's a growing aging population. If you look at folks who are facing housing instability or homelessness, as well as veterans. Veterans are a really important population to be thinking about because there's a lot of resources out there. It's just about figuring out how to coordinate and leverage those to be able to support veterans in your community. And so through our collaboration with TALB, right before the pandemic, we put out a needs assessment that looked at how much supportive housing is needed for people who are aging in New Jersey. And we looked at different sectors, which were on the left, and came up with how many people will be needing supportive housing. And we landed on a pretty large number. It's over 17,000 supportive housing apartments are needed across New Jersey. And we know this number has probably only grown with the pandemic. We, over the past year, have been working with a diverse group of stakeholders, kind of develop an advocacy agenda on how to tackle being able to add a whole bunch of affordable housing to New Jersey, which is really needed. But just wanted to put this out there that there's a significant need for affordable housing, but especially supportive housing for people who are aging in New Jersey. And the good news is that there is a lot of resources coming into the state. This is a summary of all of the federal COVID relief flooding into New Jersey. It looks at money that's coming in from HUD, coming in from Health and Human Services, coming in from the Treasury. And big picture, what we really want to see is we want to see more affordable housing development that includes supportive housing set-asides. What we ideally want to see is, when I say affordable housing with supportive housing set-asides, when we typically fund projects as a CDFI, if you say have a project that has 50 units that are affordable, our hope is perhaps half of those are set aside for supportive housing. And big picture, when looking at a lot of this federal funding that's coming in, particularly the home art funding, over 130 million coming into the state, The feds really want to see a focus on people facing housing instability and homelessness. And it would be, currently HMFA has a really great policy that for new projects that come online, there's 5% set asides for people who are experiencing homelessness. But when you just take a step back and you look at the reality on the ground and the growing numbers, we would really like to see more projects whose priority population is to help people who are experiencing homelessness and who are aging. And so there's a huge opportunity here to use home ARP funds to be able to develop supportive housing. And I'll add in the chat some of the specific funding that's available. DCA and HMFA receive specific set-asides for home ARP, but so did all counties and larger cities like Jersey City, Atlantic City, Newark, etc. And so we're really hoping that with all of this money coming in, that localities will be thinking about, how are we going to use this? How are we going to bring new faces to the table? Perhaps pair strong service providers with housing developers, bring in BIPOC-led organizations, and build housing for what Dean was talking about earlier, for communities that through redlining have been prevented from being able to access, being able to own homes or rent in good neighborhoods.
Thank you, Cassandra. And I want to, I don't mean to put you on the spot, but can you just, explain or expand the definition of what you mean by homeless older adults? Because we're not talking about people who are lying on the floor of the train station. We are talking about people that don't have stable, secure housing. It can be people going to stay with one adult child to the next on a rotating basis. So I don't want people to have the image of homeless. That doesn't apply. I don't know anybody like that, because it really is a much broader definition, isn't it?
Yes, it's a really good point. So when thinking about people who might be able to access a lot of these resources, let me zoom out. The reality is for people who are aging, most of those people are on fixed incomes, yes, or no longer have incomes if they're losing their job and they don't have retirement. And so when looking at the crazy increases in rent all across New Jersey, the ability to afford housing is one of the biggest challenges. So yes, you're seeing people who are over the age of 50, 55 no longer being able to pay their rent, probably, hopefully working with Dean's office on anti-eviction, trying to access resources. But we really want to see prevention and proactive measures and thinking about how you can divert people from shelter, divert people from homelessness. And that is absolutely a group of people that we would like to see accessing supportive housing.
Okay, thank you. So now we are going to move on to Laurie. Many of you have probably heard from her office, especially under COVID. The Long-Term Care Ombudsman's office was really doing some critical work to get us through COVID. Laurie, I will maximize you on the screen. And the floor is yours.
Thanks. Thanks so much for inviting me to be a part of this. I'm very interested in both of what, in all of what the other two speakers were saying. Very exciting stuff. I'm afraid I have jurisdiction in the area of long-term care, which is where in many cases people end up if in fact some of their other housing options are not working out. Everybody, thinks, okay, I'm not going to end up in a nursing home. I'll be able to stay at home and have my care needs met as I age. But the fact is that aging in place is a real challenge. It's particularly a challenge in the state of New Jersey, where housing costs are so high, as was described earlier. I have jurisdiction in nursing homes and assisted living facilities, residential healthcare facilities, which are kind of like boarding homes, but with a medical component, among other places. And, what we see is that basically you have to have means in order to age in place in the state of New Jersey. So in order, for instance, to get into assisted living is a great service where you basically have your own apartment, but you have supports and services and your clinical needs are being met. But most assisted living facilities are going to require you to be able to pay privately for a couple of years. And when you consider that New Jersey literally has the highest average assisted living costs of any state in the nation at around $6,000 a month, you're going to need some substantial resources in order to go into assisted living. And so what happens is you spend all of your money in assisted living, and then you're indigent, and now you qualify for Medicaid. And assisted living facilities do take Medicaid, but they're only required under state law to set aside 10% of their beds for Medicaid. And if you look at the small print on your contract with the assisted living provider, you may find that in fact, you can have one of their Medicaid beds. You may have to move to a smaller room, and you're not actually guaranteed that Medicaid bed because they may already, all those beds may already be occupied. In addition to that, you don't have the landlord-tenant protections in assisted living that you might have if you're in a regular rental unit. So the whole idea of assisted living and aging in place can be problematic when you no longer have any private funds to pay. Another model that is really a good model, but again, can be problematic when you run out of money, are continuing care retirement communities, where you start out with an independent living apartment. And then if your care needs go up, you go into assisted living. And then, you know, and your care needs are even more intense and cannot be managed in an assisted living, you might go to the nursing home that is part of that continuing care retirement community. And they really are wonderful. But the fact is that, except for some contracts where you pay a tremendous amount of money up front and you're guaranteed to have your care needs met all the way through end of life, through assisted living, into the nursing facility, most of the contracts now for continuing care retirement communities have exit ramps for you and for the provider, so that when you go into assisted living, you go into a new agreement. When you go into the nursing home, you go into a new agreement. We had a case recently in South Jersey that some of you may have read about, where the continuing care retirement community was closing the nursing home. And so the concept of aging in place for these individuals who went from assisted or independent living to assisted living, there was no longer a nursing home for them to go to. So now they need to find another nursing home to go to. So you see the challenges of aging in place, which everybody agrees is a good idea, but it's a real challenge to accomplish that in New Jersey. And so a lot of times when you're out of money, you end up in a nursing home if you don't have a home to go back to and someone who can help you with your care needs. The system in New Jersey, when you're out of funds and you qualify for Medicaid, which a lot of middle-class people do, because you might sell your house and you might bank $300,000, but if you're in assisted living or you have high healthcare costs, you can go through that money pretty quickly and find yourself in a situation where you are a middle-class person, but you have worked all of your life, but everything that you've saved is gone. And your income, you have to go on Medicaid. So you may, if you have intense medical care needs, you may end up in a nursing home. And that's where the Ombudsman's office operates most frequently. And the problem with nursing homes in New Jersey, and COVID has really shined, a light on this, is that they tend to be large institutions with 100, 200, 300, sometimes upwards of 400 beds. And nursing homes are facing the same problems that other employers are facing right now in New Jersey, in that it's very difficult to find people to work, to take these direct care jobs in nursing homes. And I will say also in the community to care for our most vulnerable citizens. And so staffing is a major issue in these facilities. And when there isn't enough staff, that's where you have issues of abuse, neglect, and exploitation. And those are the types of cases that the Ombudsman's office investigates. So needless to say, over the course of the last couple of years, our caseloads have gone through the roof. In addition, the Ombudsman's program participates in a program called Money Follows the Person. And this is a federal program that funds my office to have staff that go to nursing homes and identify people who are on Medicaid who may be able to leave the nursing home and live in the community with the services and supports that they need. So most people on Medicaid now are in what's called managed long-term services and supports program, which means that they're enrolled in a managed care organization that is managing their care. And so if they're in a managed, they have a care manager through the managed care organization, we work with them to try to get approval for the number of nursing hours or home health hours that person might need to actually leave the nursing home and go back into the community. Now, it's really helpful if they have family to move in with or a friend to move in with. But the biggest barrier, and this is what we're talking about today, right? The single biggest barrier that we have to moving people out of nursing homes is the lack of affordable, and I would add accessible housing, because often when you're talking about an aging individuals and people with disabilities, a lot of times there are mobility issues. And so you need accessible housing, need affordable housing. And we end up with, we identify people, and we have managed care organization, care managers who are ready, willing, and able to move people out. There isn't a place for them to live. There aren't enough housing vouchers. There isn't enough affordable and accessible housing for them to move into. So there are some really exciting things that are happening in that regard. I know Cassandra mentioned the housing funds that came in through the American Rescue Plan. The New Jersey Medicaid program has a very, I think, innovative and exciting program where they're actually using bonus Medicaid home and community-based services dollars to create a housing fund to develop housing for people in a lot of different categories that Cassandra talked about, but people who are on Medicaid, and that includes the aging community, people who are in nursing homes. So that's really exciting that they're doing that. But not everybody is going to have the opportunity to move into the community. We do need to get to the point where that is what we do, that we need to get to the point where we don't have these large institutions, right? As a society, we closed down a lot of the institutions for people with developmental disabilities. We have closed down large psychiatric hospitals, and yet we maintain these large nursing homes that are often run by private companies. And in my opinion, that they're too large, they're difficult to staff, they're difficult to manage, and they really don't provide the kind of home-like environment that you need to have for people who are in long-term care. And so the state of New Jersey has really leaned in, and I think in part as a result of COVID and all the problems that we're seeing in long-term care, has really leaned into trying to figure out how to reform the long-term care system. And what we're looking at as advocates and as people active in this community is, how do you get to a point where you have long-term care facilities that have single room occupancy, for instance? It would have been very helpful during COVID if we didn't have nursing homes that had 3 people in a room. Talk about infection control challenges. You have people who are on Medicaid, you're packing 3 people into a room in a very large facility, and COVID runs rampant through the facility. From a human dignity standpoint and an infection control standpoint, we need to get to the point where we have more single room occupancy facilities. We need to also incentivize more nursing care, meaning more registered nursing care. Studies have shown that the more registered nursing care hours that you have per patient in a long-term care facility or per resident in a long-term care facility, the better the outcomes are. So the state generally is looking at trying to incentivize better quality in long-term care, more single room occupancy. But we also need to look at expanding programs. Like, I happen to love the PACE program, which I think you've had presentations about PACE, Cathy.
Yeah. Yeah, we did in
your-
session 2.
Yeah, through your organization. And it's really a great model, right? Because it's basically a community-based model where you're providing people with transportation to, you have a, you know, a medical hub and a social hub where people can go. You're providing them transportation to it, but they're living in the community.
Right.
And if you're going to have long-term care facilities, let's look at the greenhouse model, right? Where everybody has their own room and their own bathroom, and where staff are very invested in the welfare and the quality of life in those facilities. There are models out there that we can adopt more broadly here in New Jersey. And one final thing, most of long-term care in New Jersey is paid for by Medicaid. And we know that, like I said earlier, eventually you're going to spend all your private funds. You're going to need to rely on Medicaid. And so Medicaid has a tremendous amount of leverage in terms of helping to design a better quality system. And I look forward to being a part of that voice and that effort.
Well, thank you. And I think it might be a surprise to people to hear that people leave and want to leave a nursing home. It's not necessarily the end stop, the last stop, that there are opportunities to leave nursing home, get back into the community if there's appropriate and affordable housing there waiting for them. So
Absolutely. I mean, we had people on our waiting list for the I Choose Home Money Follows the Person program who frankly died of COVID in the nursing homes waiting on a waiting list for housing. So there are hundreds of people at a time. And I was struck by Cassandra's number, just blew me away. 5,856. That was literally the highest number in terms of her needs assessment. So yeah.
All right. So I'm going to bring everybody back here, and you know, we'll try not to have too heated a discussion, but you've each brought up, you know, very different approaches in policy, but they all do weave together. They all connect. So in moving forward, and New Jersey is moving forward as an age-friendly state, what are the obstacles? What are the biggest challenges to moving policies that you talked about or policies that we need forward?
I'll
Who
start.
would like to go first?
I'll start. So I think, I mean, Laurie and Cassandra, you know, this is some real talk right here, right now, right? These are some really, really critical challenges that we're facing in our state. But what happens is that we are often siloed in our approach to solutions. We're getting better about collaborating, and certainly doing sessions like this where we're all coming together from our respective positions and, you know, our work isn't a collaborative opportunity. But I do think that when we do the advocacy, it needs to be really collaborative, and it needs to include in the stakeholder process, at the table, at the legislative hearings, and all of that. It needs to include people with lived experience. You know, in Maplewood, I had planning board people screaming at me and saying that I'm going to destroy Maplewood with ADUs. And it wasn't until they heard from a senior about their experience and their inability to afford to stay in town and possibly even lose their home that they got it. It wasn't until they heard about supportive housing needs, people with special needs who needed to have this in their community and be close to their families and to the resources that are available to them in the county. That is when the switch went off, the light bulb went off, right? Oftentimes it's us, it's other experts, it's consultants, it's the providers, and we do not really have at the table the people with lived experience. And it doesn't matter how good our data is and how alarming the numbers that we just heard here today from Laurie and Cassandra are. If we don't hear from the people themselves, we're really not doing what we should be doing and moving these issues forward.
You know, good points.
I so agree, because I feel that especially aging community is really so silent and not represented. You know, it's, I don't know if it's ages, I don't know exactly what it is, but, you know, I look at the people in nursing homes and it's like, I've been in human service, in and around human services for many, many years. And, you know, there's the DD community has their, you know, they're advocates, and they were very successfully advocated for a lot of community programs and got developmental centers closed, right? You know, and yet, but you have these, in my case, my area, you have the nursing homes, and you don't have this kind of organized group of people advocating other than Cathy's group, AARP. I mean, we are there, but the consumer voices really do need to be raised. And I do think we are hearing more from the family members of people living in long-term care, in my case, and from the residents themselves. And that's a real goal from my office too, because I agree with you, Mayor, that we really need, that's who the legislators need to hear from, the people with real lived experience.
And Laurie, I'm just going to jump in and say, I agree with you. And I think part of the challenge is, you know, aging is not a one size fits all. It's different to different people and with different needs. And for the most part, you can plan, you can envision your later life, you can plan on where you're going to live, you can plan your finances, but you don't know until you get there what the situation really will be in terms of your health, in terms of your finances. So I don't think that, one, I don't think people think about it. They think they have a secure plan. And two, there is so much variety. It's not that, you know, we turn 65 and everybody agrees on everything and has the same needs. So
Right.
it's, you know, it's a lot to harness all that and bring it all together. But I think you have really good points. Cassandra, did you want to join in there?
Yeah, I cannot agree more of the need for having people with lived experience at the table. You need to have their perspectives because we're creating these policies that ultimately only impact them. And when you have them at the table, they'll quick to raise their hand and point out something that no one saw that was really obvious and needed to be a focal point on. Dean also mentioned the point of siloing. And what I see as one of the biggest challenges is there's a huge flood of all of these resources. What's the overarching strategy, particularly for housing? You know, Laurie brought up, you know, the Medicaid office is doing really incredible stuff. We have a national Medicaid expert on staff, and we're so impressed with their 1115 waiver, which will include tenancy supports, fingers crossed, if CMS approves it. The home community-based services that Laurie mentioned that would create 100 deeded apartments, completely new ground for CMS. So New Jersey is paving the way for the rest of the country. And I believe the Medicaid office is also planning on creating a housing division. Department of Children and Families also created a housing division this summer. Thinking about, you know, how is DCA and HMFA's various home ARP and other funding going to be put out? Is there a way to help them incentivize and then kind of braid that that funding to be able to hopefully deploy capital for more affordable housing development? Kind of need an overarching strategy. And so I'm really hoping that Governor Murphy and others think about what that's going to look like, because also at the local level, if there's that larger vision, and of course, where people who are aging, you know, and housing for all of those different cohorts fits in is going to be really important.
I agree. You know, the housing silo issue, I'm really dating myself, but I've been in state government for more than 30 years, and it's always been an issue. Mm-hmm. Housing, you have pockets of housing here, you have pockets of housing there, but the overarching strategy, great example, Medicaid is now getting into housing, and it is like mind-blowing because the federal government would never encourage. Room and board was not the purview of Medicaid, right? Mm-hmm. But for the first time with this waiver and with the use of the American Rescue Plan funds, New Jersey's Medicaid program took that chance, and the federal government has approved it. So I think that I agree, Cassandra, this really groundbreaking stuff. And we're living in a time where we really do have to break out of those models and really lean into innovation, whether it's in the long-term care space or in the community. This COVID was awful. It was dreadful. It also shone a light on problems and has created an opportunity for some real reform.
Yeah.
And go ahead.
I'm sorry, Kathy, but I want to dovetail on what Laurie said, because it leads us to a positive message as we wrap up, in that, you know, I do think that we are talking more, and we have met the unprecedented moment that we're living in. We will never, in our lifetimes anyway, I'm also aging myself, we will never see this level of federal investment in housing, stability, and affordability ever again in our lifetimes. And I do think that that money, the CARES money and the ARPA money coming in, all of that has been really well spent in terms of mortgage assistance, tax assistance, in terms of, you know, eviction prevention and homelessness prevention, and in terms of, you know, increasing our housing trust fund in the state of New Jersey and at the local level as well for affordable developments and other such opportunities that we've been talking about. So I really want people to understand that we really, we've always said we couldn't do this and we couldn't do that. We thought about, we have always thought outside of the box, but we always blamed money. Well, now we got the money. So we need to make it happen. And we're seeing that when we collaborate across agency and when we share data, it really does lead to better coordinated and targeted results, like really targeting those areas and those households that need the assistance the most, our most vulnerable residents in the state.
So I want to wrap up with just a final question to you all. And it sounds like the COVID has helped move forward, do things in a different way, start breaking down these silos. And also on the horizon, by 2030, we know that our residents over age 60 are going to be more than the students in our schools. That is a huge demographic shift for New Jersey. That will require a lot of housing, different housing, and housing takes time. I mean, Dina and I had worked in the past about it. You can't build a house overnight. It takes planning, it takes funding, it takes space. Do you feel confident that by this demographic shift in 2030 that we're going to be where we need to be? Will we have the housing we need for people to age in New Jersey?
I think we were going to get closer to it.
Okay.
I'm always an optimist, because otherwise, why get up in the morning and fight the good fight and do all this hard work, right? We have to be optimistic. And I do think that we are doing better. But again, it really has to do with, it's not just housing. Housing is one element of communities that are truly inclusive of our aging populations and other needs, right? It is truly the master plan of every city and town that needs to include transportation. It needs to include open space for recreation and outdoor opportunity. You know, all of this is health and wellness. Housing is health and wellness too, right? So I think when all of us are doing this work and we're advocating at the State House or down in DC, if we think about it holistically as a health and wellness issue, of which housing is just one component, I feel optimistic that we can be holistic and meet the needs.
I would also say, Kathy, not to interrupt you, Mayor, but I completely agree. I'm optimistic. And I think you're going to hear a lot more about housing modifications. Housing modification is included as part of we talk a lot, Cassandra and I talk about the Medicaid waiver and things like that. Housing modification is really important because then you can take existing housing and modify it in such a way that it is accessible. So that's really important. And hitting on that issue of all of community response, right? So I think this is important in the long-term care space because we need to integrate people with disabilities and aging individuals into our community. We need to bring children into the long-term care facility. We need to have accessible transportation, as the mayor mentioned. We've been talking about silos. We silo human beings into long-term care facilities when they're older or they're disabled or they're ill. And that we really need to change our thinking in that regard.
Yeah. You know, Kathy, when I think of your question of will we have the housing that we'll need, I appreciate the optimism of both Laurie and Dean, and I'll add that, you know, this will really depend on local communities, you know, for your townships. You know, are you showing up to your city council meetings and making your voice heard and thinking about the future, and, you know, what type of housing is being discussed? Is affordable housing on the table? Is supportive housing part of that? You know, it's going to be really driven at the local level. I also wanted just to add to the piece of, you know, when thinking about within the kind of pie of affordable housing, what's the difference between someone needing affordable housing versus supportive housing, and thinking about that person who's aging, but perhaps facing eviction, housing instability. Is supportive housing is really for people for whom without services would not be able to keep their housing, and without housing would not be able to engage meaningfully in their services. So that's the key piece. And thinking about someone who has chronic medical issues and is in a nursing home and wants to step down, or someone who has behavioral health needs, who is aging and very much needs affordable housing. That's who supportive housing is designed for. And all of our communities have many people who fit those description. And so I would just really encourage folks who are listening to think about how can you add your voice in to make sure that all of these federal resources that are coming in are being leveraged, and know that there are partners, including CSH, including Supportive Housing Association of New Jersey, Capital Impact Partners, and others. We're here. You can reach out. We can help you think through what this could look like, because this is the time to build housing.
Well, we will wrap up with that. I want to thank the three of you for your great presentations and for the work that you're doing in New Jersey. It's very important work, and also for your optimism. I appreciate your optimism and your honesty, and I think it's appropriate to leave it as a call for people need to understand what's going on in their community and start asking for it, because you know, aging is the goal for all of us, and we want to be able to live where we want, when we want, and we need to plan for that in advance. So this was the last of our series on housing. The previous episodes and this will be available on our website and our YouTube channel. I want to thank Laurie, Cassandra, and Dean for joining us today, and hopefully we will have you back soon. Thank you very much.
Thanks for having me.
Thanks
Thank
for having
you.
me.